So we'll move on to the next speaker. Again, a eminent doctor from Gujarat who has done a lot of work on spirulina. He passed out in 1994, got his MBBS degree in BJ Medical College, Ahmedabad. A practicing gynecologist since 1998 at Bhavnagar, Gujarat. I have been there once, and very active person promoting DXN products and especially using spirulina very extensively in his clinical practice. And he has helped a lot of mothers to deliver naturally without cesarean section. He joined DXN in 2008 and he has done a clinical study on DXN spirulina, 53 patients in 15 months, and presented his study on many occasions. And he has been a very active speaker for DXN and has visited UAE in September 2011, and in World Ayurvedic Conference also in Pune. He presented his work on spirulina, how to protect the pregnancy the natural non-toxic way. And here is an eminent cardiologist, Dr. Ajay Kumar Ramani, who is going to present for you on his work on spirulina. Because as you know today, one of the biggest challenges what we today in India is maternal mortality and also childhood mortality. And today a lot of deliveries are not natural, they are unnatural. A lot of cesarean sections. And also I think it will be an approximate figure that 30% of Indian women, after childbirth, the uterus is knocked off. Maybe many of you would have, women here would have had hysterectomies. So that's a very, it's a very sad situation. And especially going through pregnancy is something like, having a second life. I still remember in, my undergraduate days, our textbook of, gynecology used to say, we had a very eminent gynecologist, Dr. Modelier, and his textbook of gynecology and obstetrics is a very the book which is followed by many universities. And in that textbook, you would have mentioned pregnancy is considered as a disease which kills many women. It's not so today. But still we have a lot of problems in women when they need to undergo the pregnancy. And today a lot of women, they are elderly primies. That's a major problem, because now women, they don't want to get married till 25, 27, 30. There's a lot of medical problems what they face. So I invite Dr. Ajay Kumar Ramani to deliver his lecture on spirulina.
அம்மா என்றழைக்காத உயிரில்லையே, அம்மாவை வணங்காது உயர்வில்லை.
Good morning. And every noble hearts here are sitting, and to each and every human being of the heart I love and I DXN, do through DXN. Just for introduction, many elders and lots of seniors, dignities has come for me. I just like to present my views in just whatever I have experienced in my life, in my clinical practice. Please pardon me, whatever and give me suggestions, whatever you advise me. Protect the pregnancy, natural non-toxic way. Pregnancy is not a disease. It is a change in the woman's life. It is a part of life. Woman passes through these changes and challenges and stressful conditions. And how can we protect naturally. Nowadays, what we are seeing in our practices, we are facing continuously a disease condition. Near about whatever I am going to mention detailing in my presentations. Almost 15 to 20 to 30% are some sort of disease states, though there are 70, 80, 20, 75% normal conditions in the delivery. But what we are facing that I am going to discuss and my experiences, protect the pregnancy, natural non-toxic way, and I found the way through DXN natural products. Mahadev Gynec Hospital, this is my hospital address, plot number 134, Sir Patana, Bhavnagar, Gujarat. Phone number, email address, and website address is also. Presentation by me, Dr. Ajay Mbbs, DGO. DGO passed from Calcutta ICMCH College, 1996, and practiced started in 1998, Bhavnagar, Gujarat. And till date, I have conducted more than 10,000 deliveries and lots of clinical experience, which I am going to share here. Yes, pregnancy. A physiological changes, which I have mentioned. What requires? Physiological, woman passes through these natural changes and challenges. Natural environment and natural care, adopting positive full attitude is the basic requirement. Condition should be a woman who is going to be pregnant. Woman should be pregnant with adopting positive loveful attitude. Building the strong moral character, balanced natural food and food supplements, and adequate sleep of at least 6 to 8 hours should be there for the woman. No hurry, no worry, positive attitude to face the stress of labor. These are the basic requirement to woman to be a pregnant. But what pathological conditions which we encountered during our practices? Anemia, 60 to 70%. Look this figure, anemia, 60 to 70%, and this one reference I have quoted here with the slide. Source ICMR 1989, anemic conditions, mild anemia 40%, moderate 34%, severe anemia 13%, and what severe, moderate, mild, that I am going to go through this. Moderate anemia, severe anemia is less than 6 gram %, moderate anemia less than 10 gram %, and mild anemia is less than 11 gram %. 9 to 11 is the mild degree. Preeclampsia. Preeclampsia means the rise of the blood pressure in the woman, and then she faces edema, headache, vomiting, and something going into eclamptic conditions of preeclampsia through the eclamptic conditions. That is, we called also as a toxemia of the pregnancy. Oligohydramnios means decreasing amount of the liquor around the fetus. IUGR, intrauterine growth retardation, means restriction of the growth or decreasing the whatever should be there, the growth of the fetus, decreasing of growth of the fetus by intrauterine environment by diminishing liquor and hypertension of the woman and all these things. Recurrent abortion, that means recurrent pregnancy loss. Preterm delivery, before term site delivery, septic conditions, hemorrhage, hormonal imbalance, and genetic manifestations. But health, what is health? Healthy person is who is physically, mentally, socially feels well, and nowadays also should be economically well and spiritually should be well. So health is primarily dependent on proper blood flow, especially microcirculation, what Dr. S. Ranjan has mentioned, and all the eminent physicians and are saying this, especially microcirculation. Better circulation, better tissue perfusion, and so better supply of the oxygen and nutrition and improved metabolism. So other factors also, genetic condition, hormonal balance, pH balance, infection and immunity, environmental condition, race, socioeconomic condition, emotion, and attitude towards the life. That is the main factor, mental factor for the healthy conditions. What is metabolism? Basic requirement of metabolism is nutrition, oxygen, hormonal level, detoxification, and immunity booster. This much we require during pregnancy for the normal conditions. Nutrition by proteins, carbohydrate, fats, vitamins, minerals, enzymes, and here we get by DXN spirulina, Morinda citrifolia, and Ganoderma. Oxygen we get from natural environment by pranayama, yoga, food supplements, by Ganoderma and spirulina. hormonal levels that nature is gift, nature's gift, nature balances, and also some conditions we may help as a gynecologist to the mother for the hormonal balance. Detoxification. Detoxification is the major part, and immunity boost up by food supplements without depriving liver, bone marrow, spleen and kidney, and for adopting and protecting the developing embryo. This is the basic requiring immunity boost up is the most conditions. This is like that. You just imagine these situations. For the healthy status of our person or any being, human being, we should have such type of blood circulations, this type of road system, and this type of supplying of the nutrition. This is made up of, tank is made up of hemoglobin molecule, and these vitamins, minerals, tire, chassis, and drivers, and whatever vitamin B12, what is these things. You can understand logically by this way. If we keep this, then every cell, every our vehicles can be filled up by the petrols, energy, and we can get a better life. What is TDS? TDS, tax deduction at source. Nowadays, nature also taking taxes from the health in the form of toxins, polluted air, unclean water, non-hygienic, less nutritious, more caloric food, and free radicals are continuously bombarding. Deficiency of vitamins, minerals, and trace elements, enzymes we are continuously facing. Stress, physical, mental, economical, social, in all age groups, and from childhood to the old age, we are all facing whatever people come across in our society out of DXN. We are continuously facing such type of conditions, and this is TDS theory, means tax deductions at source by our health. Nature is taking. So nature has also given solution through DXN. Nature has also given solution as a natural, non-toxic, adaptogenic DXN products. Ganoderma, spirulina, Morinda citrifolia, aloe vera. How? Now let's see. Ganoderma lucidum. Ganoderma lucidum, just let's be first understand. Adenosine and guanosine is the basic content, the polysaccharide, organic germanium, triterpenoids and ganoderic acids. Adenosine and guanosine produce vasodilatation, antiplatelet effect, so anticoagulant, as an anti-inflammatory, antispasmodic,